Hello, I'm Locke Meredith. I'd like to invite you to join me in the next Legal Lines. We have on the show Dr. Ned Martello. He's a doctor of chiropractic medicine. He's going to talk to us about the education of a chiropractor, and he's also going to talk to us about how they diagnose the injuries and how they treat you when you're injured in a car wreck or whatever. And they're also going to talk about how they treat you differently from, say, an orthopedic physician or a physical therapist. So join us on the next Legal Lines with Dr. Ned Martello.
Television has evolved to the sensational. Cox Digital Cable is high touch with an interactive program guide anyone can use. Cox Digital is tasteful with sophisticated programming choices that stimulate, educate, and make you feel great. Cox Digital is sight and sound extraordinaire, especially on an HD set. Eye-popping clarity and 5.1 surround sound. Cox Digital lets you smell. Well, we're working on it. Experience the digital evolution with Cox Digital Cable, television for the senses.
Welcome to Legal Lines. I'm Locke Meredith, and I'm pleased to have on the show today Dr. Ned Martello. He is a doctor of chiropractic, and we're going to talk about how that is different from, say, a medical doctor or a physical therapist. Ned, thanks for being on the show.
Good morning, Locke.
For the folks, give them a little, just personal information on yourself, married, and your educational background.
I'm from Baton Rouge. Graduated from high school at Estruma High School, and I started LSU in a pre-med curriculum. I had an interest to be an orthopedic surgeon. I transferred eventually from LSU to Hammond, to Southeastern, and still continued in the pre-med curriculum. However, on a canoe trip, I injured my back, and as a poor college student, didn't have any insurance, so I figured I need some help.
You're hurting.
Yeah, I was hurting in my back. So I went to a chiropractor, happened to be my cousin, and he did some treatments on me, and it felt great. And at that point, I decided, wow, what would I have done if I'd have gone to a medical doctor or, had a problem that I didn't know could be as easily fixed with chiropractic? So it amazed me so much that I decided to become a chiropractor myself.
It's an interesting story because it's basically you initially were going into the medical field of caring for folks in the context of med school and all of that, and then chose really what has now become an accepted profession. But for a while there, people weren't quite sure what to think of all of that.
Well,
but I thought it was interesting you were telling me about that it's been in existence for how long?
Since 1895.
Here in the nation.
In the United States.
And the Chinese have been using it since 2000 BC.
BC, 2000 BC, there are indications that Chinese were performing manipulations.
So this kind of care for an injury to the bones or the spine has been going on for thousands of years.
Absolutely.
Well, so tell me, so you had, I think you told me you had 5 years of collegiate education, decided because of your own personal injury and the way that you were healed to go to chiropractic school. What is that? Chiropractic
school is a school of its own. It's not a member or affiliated with any of the medical schools. Chiropractic basically deals with restoring normal joint function. In school,
describe a joint for folks. What's a joint?
A joint is where two bones connect together.
All right.
Ligaments hold one bone to another. Ligaments connect joints. The joints provide movement so we can propel or get around and do the things that we need to do on a daily basis.
For example, the knee, you got your lower leg bone and your upper leg bone, and they're connected in the knee. The knee's a joint. It allows mobility.
Correct.
All right. And the reason they stay together is because they have
ligaments.
Ligaments on each side and muscles that surround it and allow the mobility and control the movement.
Correct.
All right. Same thing in the spine.
Same thing in the spine. There's more joints in the spine than there are in the extremities.
Every vertebrae or backbone.
There are like 22 joints to each vertebrae.
Okay. So you go to school and describe the process of being educated there.
Our curriculum, chiropractic curriculum, parallels medical school curriculum probably 100% for the first 2 years. It's after the first 2 years that the two schools actually differ.
So what do you study for the first 2 years?
First 2 years you study anatomy, physiology.
Define these things for everybody.
Okay, anatomy
we're lay folks.
Is the body parts. Physiology is how do the body parts function. The skeletal system we learn, the nervous system, the vascular system, the muscular system. We learn all the parts of the body, and just like as in medical school. The other classes are, the genetics and histology, basically
What's
all
histology?
the same. How the tissues are formed.
So basically, you learned everything about the body so you can work on it.
Pathology, radiology. We're physicians.
Okay.
After the first 2 years where the two curriculums actually separate or differ, chiropractic school, we spend the next year and a half, 2 years, studying principles of chiropractic, how to do what needs to be done in a particular case. We study more x-rays than I think the regular medical physician studies.
Why is that?
We rely heavily on our x-rays. X-rays are the blueprints of exactly what our spine is doing. If we're going to be manipulating the spine or tweaking the vertebrae, then we need to really see what's happening with them. Back pain can be caused from several different things. Could be a tumor, could be osteoarthritis, or could be just a vertebrae out of place due to an accident or an injury. So we would like to see what's going on. Older people, women, for instance, osteoporosis is prevalent. We need to know how brittle are those bones before we go pushing or twisting on them.
So the x-rays, you guys actually look at them. You're trained to read the x-rays. You know where the bones generally are supposed to be, what a normal x-ray looks like, and you're able to compare it. And that helps you what? Diagnose the injury or the symptom-causing problem?
It can help us diagnose, but more or less it shows us where the problem areas are.
How?
Degenerative changes, in other words.
Which is what? You're using a lot of, and I know it's normal for you, but you talk late to me, degenerative changes.
Degenerative change. Bones can change shape, okay, due to abnormal pressures that are applied to the bones. Orthodontics, for instance, works. Braces or metal plates are applied to the teeth, and there are little rubber bands that are applied from one tooth to the next. It's that constant sustained pressure from the little rubber bands that puts pressure on the tooth, which sits inside the jawbone, and eventually that pressure gets the jawbone to change shapes. In osteoarthritis, we're talking about injuries, ligamentous injuries that heal with scar tissue can cause the abnormal pressure on a joint. Scar tissue does not stretch like normal ligament tissue does.
Okay.
Therefore, there's sustained abnormal pressure on the joints.
Meaning that it's constantly being pulled or pushed out of its normal, customary position.
Exactly.
Interesting.
The bones will become prone to changing shape just as orthodontics works. When we see that type of stuff on an x-ray, we know that that's the problem area that this person's problem is basically coming from. And
you treat it, I guess, in a number of different ways, but primarily how?
By manipulation.
Okay, define manipulation for me.
Manipulation is correction of a malpositioned vertebrae.
And I thought it was an interesting analogy. We were talking before the show that somebody who suffers TMJ, temporal mandibular joint injury, where let's say somebody gets hurt in a car wreck, their jaw is thrown into the dashboard and it knocks it back. The way that is healed or attempted to be healed is using splints to put that joint back in the area that it was supposed to be. That's kind of what you do. Is that right?
Basically, it's the same. We do our work at the joints, okay? In the TMJ problem, for instance, whenever somebody's flying forward and they hit the dash or steering wheel, and you figure, yes, it can hurt the jaw, but the jaw's connected to the head, which is connected to the spine. So when you take a blow here at the jaw, it's actually affecting your neck as well, or can affect your neck as well.
All right, and so primarily, and I thought it was interesting, the definition of a chiropractic. Break it out for me.
Chiropractic. Chiro means hand. Practic means the use of. So chiropractic is the use of hands. We use our hands to treat people without drugs and without surgery.
All right, and what else do you use other than just manipulation?
We do physical therapy adjuncts or modalities such as electrical muscle stim, ultrasound, stretching, exercise. We do physical therapy type of treatments.
All right, on the next segment, let's talk about how you typically diagnose and treat a patient. This is Locke Meredith with Dr. Ned Martello. We'll be right back.
Ever wonder what happens to satellite TV when bad weather hits? Well, when the storm clouds come, satellite can go. Bye-bye. Which is why I stick with Cox. With Cox, I don't have to worry about losing the signal, no matter how bad the weather gets. But if a storm does hit, I can check the local conditions 24/7, which I can't do with satellites. So I always rely on Cox to keep on running, instead of just running away. Don't get stuck with satellite.
Welcome back to Legal Lines. I'm Locke Meredith, and again, pleased to have on the show Dr. Ned Martello. He's a doctor of chiropractic. And Ned, talk to me about, let's say I get in a bad car wreck, my neck's killing me, my back's killing me. I come into your office and I say, Doc, help me. Take me through a typical process that you go.
Okay, I would take you in and do a history.
Which is
happened,
what?
What happened? How did you hurt? How did you get hurt? What was involved? Okay, if you tell me it was an accident, and I would, after do a history, then I'd go ahead and start an evaluation, examination.
I noticed when I was reviewing your history form that it's a very detailed history. You want to know the speed of the vehicles, the direction of the impact of the other vehicle, what kind of rotation. Why do you want to know all that stuff?
Those things are very important. Your position upon impact. There's normal movements that your spine can actually, perform, and whenever you're taken beyond those normal movements, then there's going to be an injury. Bending your head back and down is a certain limit to that. When you rotate your head doesn't go back or forward as much as it does when it's unrotated. So when your head is rotated at impact, you've limited some of the flexion and extension motions. So therefore, it's really important because it's really jamming on the joints and can cause some ligamentous injury.
So what you learn from the history is basically the biomechanics of the injury, how it happened, and that helps you, I guess, diagnose what the injury is and what kind of care you have to provide?
Absolutely. It also, we try to weed out what was maybe pre-existing at the time of the injury.
Why is that an important issue, pre-existing problems?
Well, legally, I mean, if you're a patient that had some problems or a person that has some problems, and you need a treatment, but you can't afford it or don't know what to do for it, and you get in a small accident and you think, oh, this is my key. Let me use this to get that problem.
So you got some folks that manipulate the system.
Oh, absolutely. I mean, I think in every profession you're going to find people trying to manipulate the system.
So you try and weed out those who are trying to manipulate the system from someone genuinely injured, I guess, in a wreck.
Correct. I want to find out what is the real reason that person is here, okay? What are the actual complaints? And I figure that out through the history, and then I do an examination.
All right, let's go through the exam then. What typically is your exam comprised of?
Typically start out with a range of motion analysis. How far are they able to bend, down, up, tilt left, tilt right? There are normals to each thing, and we evaluate that. Is that normal?
How do you evaluate that? Is that something you just eyeball, or is there some kind of equipment you use to help you determine range of motion?
First thing is we eyeball it. If it appears that it's 90 degrees of rotation or 80, which is normal.
So I guess that's normal? What, 80
right.
to 90 degrees?
80 to 90 degrees is normal.
Okay.
You can turn 80 or 90 degrees to one side and only 50 to the next. And I look at the facial expressions. Usually if they turn in, and I can see a facial expression of pain, I know they're probably putting in maximum effort, but it's not normal to turn 80 degrees one way and only 50 the other. If there appears visually to be a difference, then I get analytical with it. I've got a protractor or a goniometer is what it's called, and I measure to the degree how far there is.
Okay.
I record those findings. I go into an orthopedic examination. That's orthopedic testing is applying some pressures or tension or stretching to find out what provokes the pain and what actually alleviates the pain.
And what specifically do you do? How do you do those?
By hands-on. We put our hands on the patient. Let's say cervical compression. I stand behind the patient. I put my hands on their head and just apply some pressure down.
And this is something that an orthopedic doc would do also?
Oh, absolutely.
Okay,
this is
so
standard
you're
orthopedic.
basically doing an examination that an orthopedic physician or any other physician who's treating that kind of injury would be doing?
Correct.
Okay. And so you said, what's it called?
Cervical compression test.
All right. And what does that tell you?
Under normal circumstances, I could take your head right now and push on it, and it should not cause any pain.
Okay.
If I push on a patient's head and put just gentle pressure down, they it's painful, then I know that there's probably some ligament or muscular damage there.
And the same as it relates to the inability to rotate your head fully, it would tell you what? There's a ligamentous or muscle injury?
Correct. They would indicate where the pain is, and therefore that would usually indicate where the problem is.
All right. What other orthopedic tests do you do?
Soto Halts is another test where the patient's lying down. We put our hand on the head. We stretch the head toward the chest. And if that's a normal circumstance, that would not hurt.
So that's another kind of range of motion exercise.
It's a range of motion. It's not an evaluation of the range of motion, it's evaluation of does that cause pain.
Okay. What other exams?
Other examinations is Jackson's compression test, other
Which
things.
is what?
As I mentioned earlier, the rotation takes out some of the range of motion. We rotate the head, we tilt it back, and then we apply pressure. That maneuver limits the opening where the nerve is coming through the spine, okay? Normally, it doesn't hurt to do this. If the bones have been shoved out of place or knocked out of place, they've been misaligned due to this trauma, and we bend it, twist it, and push down, it's going to become painful. Under normal circumstances, that does not occur.
Okay. What other orthopedic tests?
Orthopedic tests,
Or what other tests do you do or in your
well,
exam?
we do neurological testing.
All right, so you do kind of the joint bone kind of test, which would be orthopedic, and then you do neurological.
Neurological,
Which
correct.
is what?
Which is checking to see if the nerves have been interfered with or the nerves are functioning properly.
And how do you do that?
We do that by, first of all, deep tendon reflexes. We strike the tendon with a hammer, and there should be a jerk.
Explain that. I've always been curious as to how does that help doctors diagnose an injury?
To me, it is very simple because we know it. As physicians, we know that. But it amazes me that whenever I do check a reflex on a patient, they freak out like, wow, that jump. It's really easy to understand. Nerves are the transmission lines from the brain to whatever part of the body we're checking. Under normal circumstances, those nerves are uninterfered with, and it's transmitting that signal to and from the brain without interruption. When there's an injury causing the nerve to become pinched, that transmission is interfered with.
I've always thought of it like a water hose. Water hose going down. If you kink it, the water's not coming out, so the message is not being transmitted.
Basically, that's correct. The muscles detect stretch. When you stretch it, strike a tendon with a hammer, the muscles stretch. That sends a signal to the brain, hey, some outside force is acting upon me, possibly can damage my body. Do I sit here and wait for that pressure to stop, or keeps on till it crushes a bone? Your brain's not going to let you sit there and wait. The brain says, hey, some outside force is being applied. The brain sends a message to the muscle and says, tighten up, pull your parts together.
Interesting.
So therefore, there should be a constant communication between your parts of your body and your brain. And that communication is carried through the nerves.
So the neurological testing is testing whether there's an interference between the brain's communication with whatever part of the body you're examining.
Exactly.
Interesting. What other neurological testing do you said the absent reflexes, I guess, hitting the knees
The
to
absent
see
or hyperreflex
what would
is
cause an
indication.
absent versus hyperreflex?
Well, the hyperreflex mostly is going to be an upper motor neuron lesion. It's something in the spinal cord or the brain.
Okay.
Other than the peripheral nerve.
An absent would be caused by what? Interference with the nerve root?
Correct.
Okay. Let's continue discussing that component in your further examination on the next segment. This is Locke Meredith with Dr. Ned Martello. We'll be right back.
Call 615-1000 now and let Cox save you a bundle. It's as easy as 1, 2, 3. When you combine Cox Expanded Basic Cable, Cox Preferred High-Speed Internet, and Cox Unlimited Connection Telephone, you save big. Save $10 a month on cable, $10 a month on high-speed internet, and $11 a month on telephone. Along with our no-cost modem, that's a savings of over $475 a year. Call 615-1000 now. We're here for you 24 hours a day. Now it's as easy as 1, 2, 3 to save a bundle with Cox.
Welcome back to Legal Lines. I'm Locke Meredith, and again, pleased to have on the show Dr. Ned Martello. He's a doctor of chiropractic. Now, we were talking about the neurological exams and how basically what you're checking for is any, I guess, interference with the brain communicating via the nerves with some part of the body. And I actually have a model I use in trials. And as I understand it, tell me if I'm wrong, we've got the brain that sits up here and the spinal cord that runs out of the brain down the backbone.
Correct.
And then the spinal cord has nerves that run from it. Up here it would be to the upper extremities of your arms, and down here it would be to your legs.
Correct.
And then of course you've got nerves running to run other functions of your body. But what you're checking for in the neurological examination is whether there's an impingement or an interference with the brain communicating with the part of the body via these nerves.
Correct.
All right. So what all in the body has nerves? As I understand it, you know, we're talking about the cord and the nerves here, but the discs themselves or the ligaments have nerves in them.
Absolutely. Locke, every part of your body has a nerve going to it. Okay, whether it's your skin, your intestine, your vital organs, the joints, everything is innervated. When you break a bone, it hurts. How do you know it hurts? How do you know it's broken? It sends a signal to the brain. The brain, sends a response. Oh, it's broken or it hurts. Let me get to the doctor and find out what's wrong.
And so if we have a tear injury or a stretch injury, not only to the cord or to the nerves that leave the spinal cord, but also to the discs themselves or the ligaments, you're going to have pain.
Oh, exactly. The ligaments as well as the disc are definitely innervated in themselves.
And the disc, just for the folks to understand, is these are the backbones or the vertebrae of the spine, and the disc is like a jelly donut that allows mobility in the spine.
It's a cushion between the bones, and it also acts as a ball-bearing type pivot area.
And when you have an injury, and on this model, it's an injury to the lumbar spine, a lumbar disc, where the disc actually bulges out. And it either bulges or actually ruptures, and the jelly substance inside the disc will press against a nerve. In this model would be a nerve going to the right leg.
Correct.
And so you will treat that kind of injury amongst
Correct.
many others.
Correct.
How do you do that? How do you treat these kind of injuries without medicine or surgery?
Well,
Because that's really the distinction between you guys, chiropractics, and medical doctors, isn't it?
correct. In the second half of our professional schooling, as I mentioned earlier, we apply chiropractic principles or learn chiropractic principles and manipulation, whereas in medical school, they're taught toxicology, pharmacology classes, which drug interactions or for whatever conditions, and actually how to use a scalpel.
So explain to me how you would treat this disc injury right here.
Well, depending on how bad the disc injury is, there are certain things that we go by. If there's loss of bladder continence or just unrelenting severe pain, then we would first of all send for diagnostic testing to see if it's safe to do manipulation to the problem of this patient here at hand.
Okay, so you said previously that y'all take x-rays to look at the bones. There's other diagnostic tests that you use?
Oh yeah.
What are they?
We're licensed to order any type of diagnostic test that we think is needed to accurately diagnose this
I
patient.
know you use MRIs.
MRIs, CAT scans, nerve conduction test, electromyography test, muscle tests. Those are tests that we send out to get done.
And those really help you objectively, meaning that you can look at something on a piece of paper, on a film, and determine whether or not you have an injury. For example, an MRI might show that disc bulge injury right there, as might a CT scan.
Correct.
And the nerve conduction studies are actually checking to see via responses in the appendages or your arms, let's say, whether or not there's an interference with the brain's attempts to communicate.
Correct.
Okay. So let's say that you run those tests and you've determined that this is not a situation where you need to refer your patient to an orthopedic or a neurologist or a neurosurgeon, because you do that, right?
Oh, absolutely.
What do you do?
I would start out with our chiropractic treatments as far as manipulation is concerned. I would, again, look at the x-rays, and if I can see a bone has been tilted or twisted, and in reality it needs to be leveled or straightened, then we do that. We do that with our hands. It's kind of like popping your knuckles, okay? There's no pain really involved in it. If you got muscle spasms and it's tender whenever I poke on your back or wherever it's hurting, yeah, and we do our treatments, you can expect it might be just a little instantaneous pain there, but nevertheless, it's really pain-free.
I know a lot of folks just would give up their life for their chiropractor because they have experienced, in fact, my brother-in-law, Stuart Bosarge is one of them, says, he had a horrible back injury, went and the chiropractor fixed him, and other people are terrified because they hear it's cranking and yanking and all that stuff.
It's a lack of knowledge, Locke. If you don't know much about something, then how do you know, or how can you even decide whether that something is good for you or not? It's basically a lack of knowledge, and that's what we need to get out is knowledge as to what chiropractic really is.
So there's no going in there and yanking or pulling people around in a horrible fashion. It's basically a very controlled, specific use of minimal force to realign the spine.
It's systematic. I have a care for helping my patients. I've got a living to make, and I'm making a living helping those patients doing what I know best to do, and that's to provide manipulation.
So how often do you have to undergo this manipulation process? For example, if the injury's to the lumbar spine, you got a vertebrae that's not looking right.
It depends, again, the severity after, that we can come up with during the evaluation, but nevertheless, treatments typically are about 3 times a week. More severe problems, maybe more than that. Less severe, less than that, of course. But nevertheless, Our treatment is not only with the manipulation part just to realign the vertebrae, but in injuries, there's been overstretched ligaments and muscle tissues. Ligaments heal with scar tissue. Scar tissue is not elastic. It does not stretch like your normal ligament. So part of our treatment is physical therapy modalities that we use: electrical muscle stim, ultrasound, massage, stretching techniques.
Now, what's all that supposed to do?
Those are supposed to either relax a muscle, because if a muscle is tight, the muscle job is to move a bone. When a muscle tightens up or is in spasm, it's pulling tension on a bone, can eventually twist or misalign that vertebrae. We want to relax that muscle, which is part of the physiotherapy modalities that we use, so that it'll be easier to manipulate that bone to put it in place.
And I just leave it there.
Well,
because if the back continues to spasm, it's going to pull it back out of whack.
Exactly, and
Okay.
that's what the other part of our treatments try to do. Let's put it back in place. Now let's do some procedures to try to keep it in place. Let's tighten up some muscles that need to be tightened, or loosen muscles that need to be loosened. Let's apply some therapies that are going to help this scar tissue whenever it gets laid down, to lay down in a favorable plane that will maximize the range of motion instead of restrict it.
Now, how long? You said 3 to 4 times a week. For what period of time would be customary?
Customary is 3 times a week for 2 to 3 weeks. We do taper our treatment plans down as we see a patient recovering. It typically goes down to twice a week for probably 4 to 6 weeks, and then once a week. At that time, we're on rehab. We want to strengthen the muscles. At that time, the bones are back in alignment, and then we want to rehab that area to keep the vertebrae in line.
So as I understand it, you identify an out-of-whack vertebrae or joint. You try and relax the muscles and reduce the pain stimulation from the ligaments. Once you've done that, and that's to keep pulling it out. And then you strengthen the muscles and the ligaments to hold it in the correct position.
Correct. Basically, that's it.
Really, that's very interesting. And of course, you defer to the doctors, medical doctors, and refer to them when you deem that it's appropriate. It's something you can't fix.
Oh, absolutely. There are some conditions there that I know I'm not going to be able to fix, and I'll send them to the appropriate healthcare provider.
Ned, thank you so much for being on the show. Appreciate it.
Thank you, Locke.
We'll get you on again. This is Locke Meredith, Dr. Ned Martello. Thank you for being with us.
Fast is fun. Fast is knowledge. Fast is possibility. That's why Cox is introducing its fastest high-speed internet ever. Now up to 5 megs. So you can do more on the internet than ever before. Cox high-speed internet is fast. And fast is beautiful.